Okay, with that, I'd like to introduce Marie Crosson, a leader in the Tennessee treatment court movement. Welcome, Marie.
Thanks.
Tell us a little about yourself.
So I have been working with the treatment courts, or in Tennessee we call them recovery courts,
Trying to get to that.
for a while. I worked in one of the drug courts in Tennessee in the late 90s and have worked in various areas since then with them. So I've been around the recovery court field for a while in treatment and in the justice, usually working with justice populations, in community-based treatment, in the prison, all over the place. So I have a heart for not only treatment and what we do with recovery courts, but for the criminal justice population specifically. I have a passion for working with them.
Okay, that's interesting because you're a clinician by trade then, correct?
Mm-hmm.
So when did your clinician background cross over specifically into working also with the justice involved?
I actually left clinical work full-time when I left the drug court and was asked about a position with the state working with programs that did the work that we do. And, I'd been toying with, something a little different, and I took the job, not really knowing what it was. And it kind of has blossomed into what's been a great place for me, in space for me, in my passion.
Okay, and so you mentioned that your treatment court experience, or as you say in Tennessee recovery court, started in the 90s?
Yes.
What drew you to the recovery court movement? How did you get more deeply involved or involved at all?
I was looking for a job. I was working at a therapeutic community in the Tennessee Prison for Women and was looking around for something different. And had a friend, I think, in the drug court, on the drug court staff who called me and was like, hey, we got a position open over here if you're interested. And had the extreme pleasure of working in DC4 with Judge Norman, who is one of the rock stars in the state of Tennessee. And so, yeah, it's funny because we were funded in that program by a grant that then when I went and worked for the state, I was the oversight person for the grant that I used to work under. It all just sort of came full circle in a way.
But before that, what had you heard about recovery courts?
Nothing.
Nothing. So you came into the cold.
Yes.
And what were your impressions as you became more involved?
I loved the justice population is something I'm interested in anyway, so I loved working with them. I found the non-adversarial approach really fascinating because I had done work with the justice population where I was going into court and I was watching the attorneys have conversations about people, where the person's just sitting there and not really part of the conversation, right? And the drug court was completely different. There was a treatment conversation, or a conversation that was specifically around treatment, which was pretty fascinating. I didn't really, we were so young at that time. That drug court was two of the first drug courts in the state of Tennessee, and so we didn't really call ourselves that necessarily at that time, if that makes sense, until we received funding in the state later on where we were, sort of legitimized in the state legislature. So at the time that I was working in the drug court, I was really just working with people who were, not incarcerated and in our program instead. And that's how I really saw it at that time.
Okay. You also emphasized that there was a conversation around treatment. Am I hearing that prior to that, was that a new experience then in terms of justice involved and the conversation not being focused on treatment?
So in jail and in community-based providers, we were providing a service to folks in the justice system that was really outside of conversations with the court system. The court system would tell us what they wanted, and then we would deliver in a way. And so, yes, it was new for me to experience that coordination and collaboration between the court and the court processes and the treatment people, and them actually having conversations about the participants together.
Okay. So now I understand and make sure that I use the right title. You are the president of the Tennessee Recovery Court Association?
Executive director.
Executive director. Well,
My president is somebody else, yes.
Okay, all right. But so you are the executive director.
Yeah.
Tell us a little bit about your association.
Yeah, so the Tennessee Association of Drug Court Professionals, we are doing business as the Tennessee Association of Recovery Court Professionals, but have not legally changed our name at this point.
Okay.
So the Tennessee Association of Drug Court Professionals was actually founded in 2001. And until they hired me in 2012, we're a voluntary board that mostly did conference planning. They were really established because of the legislation that the field kind of knew was coming. And so the leaders in the recovery court world in Tennessee were getting together, having conversations about, we might have something to say about any legislation that might be coming into play or any funding that might be coming into play for our programs. And we might need to kind of find a way to organize. And that's really how it came to be. And since 2012, when the current president at that time came to me and said, because I had a child and I was actually working on my PhD, he came to me and said, we're thinking about hiring a director, an executive director to, take us to the next level, so to speak. You have any interest in that? And it was like it was like a godsend because I missed the work, right? And so it ended up just being a win-win for, I hope, and they feel that way. So it was a win-win for all of us.
You are the inaugural and still and first and only executive director.
10 years now.
10 years now. So
Yeah.
what have you seen with the association over those 10 years? How has it changed, evolved?
Yeah, it's been amazing. A little bit of a, kind of hang on tight, because here we go. When they hired me in 2012, we hired a strategic planning consultant and began to have some regular 3-year strategic planning sessions that every year we would reevaluate. And it was clear at the first strategic planning meeting that I went to as their executive director that they had big ambitions in terms of just, the kinds of things they wanted to do. They obviously wanted to stop being seen as a conference planning committee. And I don't think anybody in our state would think that that's what we do now, although that is certainly a big piece of what we do. They also wanted to be more involved in legislative issues and, being seen as the expert and providing expertise around criminal justice issues and specifically anything involving recovery court. They wanted, one of our kind of measures was when we would know that we're beginning to be seen in that light, when people start calling us from the paper or from the state agencies asking us for our opinion. We'll know that they're beginning to see us as not just a conference planning committee, but as something more. Resources, we talked a lot about additional training and resources for the recovery courts in the state and being able to support the oversight agency at the state of Tennessee in their work, because I don't know about where you came from, but usually our state folks, they are very, very busy. They're great at what they do, but they might be understaffed. They're juggling all of the different things that they have to do. And so, we provide a lot of support around technical assistance and training for them.
Sounds to me like you achieved the goal of being seen as more than just a conference planning committee, because what you just described was a number of very significant things. Did I hear you say that you wanted the association to be seen as influential on broader criminal justice issues, even beyond the treatment court world? Talk a little more about that.
Yes. So we have sat on the opioid task force for any legislative and state regulations that have occurred with our buprenorphine clinics in the state of Tennessee. We have been able to give some feedback around how that might impact us and, the expansion or not expansion of services around buprenorphine programs. We have sat on task force around CIT training.
Say what CIT.
Yeah, crisis intervention training that's often very law enforcement focused, and law enforcement gets trained, and then there are kind of support services that are provided to law enforcement as they go out on calls, and it's a great tool for local counties and cities to have access, their law enforcement to have access to kind of training and ancillary support when they're really going on calls that are mental health or substance use focused. And so we have worked with things like that. If it relates to criminal justice and it fits sort of in our wheelhouse and we are collaborators with those kinds of programs, then we may or may not be a part of those conversations.
Well, with probation as my background, I have to ask the question, do you feel like you've also been a resource or an impact on probation or community supervision issues around the state?
Yeah, we have a lot of probation staff that come to our training, not only our annual conference, but to our other trainings that we do because they're on the teams of our recovery courts, right? And yeah, community corrections. We have community corrections programs all over the state of Tennessee, and they often are in some way, shape, or form involved in the recovery courts in their communities. And so we have relationships with usually the local, but also the state office. So yes, I would say that that's absolutely true.
Okay, you mentioned your conference. I'm going to get to that a little bit later. But does your association have members?
Yes.
How do we join? How do people join?
Usually on our website, there are a lot of different options that you can choose from, and I have a membership coordinator that you can email and ask questions if you need help with the website or accessing it, because you can be an individual or you can be a team. And if you're a team, that usually means the coordinator, director, or the administrative person, for the team is calling us, and there might be some additional support needed, but on our website.
Okay, so on the website, as individuals, as a team.
Or even as an organization.
That was what I was gonna
or
ask.
student. We have a student rate, we have organization rates, because we do work with some organizations that are not recovery court teams in the state. They might have a number of staff that might be on teams, in their region even, and they find that the CEUs, et cetera, are nice for their staff, and so they'll get an organizational membership, and they might have additional staff that,
What is your membership right now, roughly, numbers-wise?
600.
600? Do you have any goals in terms of where you feel like you want to be from in a number standpoint?
It's funny because I'm saying that and I'm just now realizing I think that was the number of our very first strategic plan. I'll have to go back and look.
See, we're having this conversation and realizing you're hitting your strategic plan goals.
Because one of the things that we realized as we were sort of working on membership and what that looks like is, how to make sure that membership is really, that we're relevant for the people. I mean, to grow your membership, you really, for it to be sustainable, you want to make sure that you are adding people that find value in what you do and that care about what you're doing, and they stick around. So we had some sort of growing pains as we added membership that really wasn't right for us, et cetera, and have learned kind of where to go to find those folks that are our people, so to speak. And so it's interesting to know that, but I don't remember the question you asked because I really got stuck on the 600.
That's because I asked what your membership was, and then you seem to recognize that was pretty close to one of your strategic goals. So
yeah.
Congratulations on that. How much farther will you go?
So we have talked a little bit about additional membership around bar associations, legal bar associations, talking to the Public Defenders Conference and the DA's conference and things like that, really focusing on adding quality for them, but also, bringing them into so they can get CLE and receive the training and technical assistance that we provide. So we focused on that. I don't know what that means like in terms of a number, though. We began at our last strategic planning discussion talking about quality over quantity.
Certainly.
And so, really finding what makes the most sense for us in building relationships, knowing kind of where the state's going in criminal justice reform and adding more mental health courts, et cetera. So, yeah.
Okay. Now, the conference. Talk to us about the conference.
Yes. So even at the state, before I became the executive director for the association, I worked with the Tennessee Association of Drug Court Professionals as the state drug court administrator on the conference. So I worked with the conference planning committee, basically, the association from that perspective. So I've been doing it for a long time.
Okay.
And I remember the very first one 18 years ago. And we had maybe 40 people or something, and it was in a state park. We had one room, and we were there for the day, something like that. And now, I have a conference committee. I have a conference coordinator. I have a conference committee. That committee begins to meet basically as soon as the previous conference ends. We take a look at the evaluations from that conference and see what sticks out in terms of things we need to consider. Things that we need to add, things we need to consider in terms of our schedule and the way and the processes, right? The way that we conduct the conference, but also in terms of topics and presenters. And then the conference committee starts working on those things right away.
So no break, no rest for the conference committee.
I mean, they might have started beginning of March. We probably were talking to them in January and February, and they might have had their first meeting in March. So no, not really.
So do you have generally a conference theme each year?
Yes.
How do you talk to us about how you go about forming the conference in terms of who you want to speak and the topics you want to have touched on?
So a lot of that we do an RFP, and so we ask for proposals for the conference. And once those come in, the conference committee reviews those. They make a selection of those, and then once we know who wants to actually come talk to us, then we also reach out to speakers or organizations around additional topics based on either the evaluations from the previous year and what people are saying that they would like to see. Conversations we have with our state partners, because our state partners are really in touch with the kinds of things that our recovery courts need to know about and need to be talking about, or anything that might relate to an initiative at the state level that would be appropriate to include at the conference, like mental health courts. The mental health courts is a big one this year, and adding more content that is mental health court related, because we just received an appropriation and some oversight language for mental health courts for the Department of Mental Health and Substance Abuse Services. And with that will come, of course, some training for mental health court folks. So, looking at those kinds of things. And then conversations. I tell people all the time, I come to the national conference to scope out, to do recon, to scope out potential speakers for our conference. Sure. Topics, I'll go and I'll listen, and then I'll meet the speakers and I'll introduce myself and get to know them and invite them to come to the conference. So a variety of different ways. And the conference committee, they always are great about bringing ideas to the committee meetings too. They'll jot things down as committee members, if they hear a great speaker in a different state or anything, something that's fresh that we haven't heard yet, and they'll bring that to the conference committee meeting or email me so we can add it to our notes.
That really makes me want to know, you mentioned mental health courts. What other kinds of things have been popular at the conferences that you've had, or what areas of interest that stand out in your mind that people have been interested in?
Yeah, so co-occurring, working with folks with co-occurring issues has been a focus or theme in the past. Anything that is trauma-related, trauma-specific, trauma-informed, we have included that, and that's been a focus in the past. We had funding for a couple of years to have a Veterans Treatment Court track. And while we don't have that funding anymore, we have Veterans Treatment Courts that come to our conference. And so we ensure that there are Veterans Treatment Court specific and or, integrated training for them as well at the conference. MAT, when nobody wanted to do MAT and it was a big thing, we were constantly at the conference finding ways to have conversations around medication-assisted treatment in a variety of ways, bringing in experts, having panels a panel of experts or participants or staff from recovery courts in Tennessee talk about implementation, whatever, we needed to do to help the field, learn and grow in that area.
Certainly. What other services do you offer your members?
So we focus on advocacy. So we are, looking at the legislation that comes in and, sharing that with the members. So we'll do legislative updates around anything going on during the legislative season. If there is an issue that is going to directly affect us, I might, go have conversations with legislators, bring a program with me if that's appropriate, and talk to them about how that might impact recovery courts. So we do advocacy for all of our recovery courts in Tennessee. Obviously, we do training. We have the annual conference. We will bring in, different training at different times. An example is a standardized tool to do an assessment on services for families. The state has a grant and is doing some evaluation around that, and so we've had some additional training for that. The state uses the Ohio Risk Assessment tool, and so we will have training brought in for that. We also last year started a Lunch and Learn series that is online, on Zoom basically, and that has been very successful. People love that, and so we maintained that this year, and I bring in speakers from all over, and I do some of them. We do a variety of different things based on what people have asked for, and it's an hour, at lunchtime, so they can do it as a team or whatever, and that's been really successful too. And then resources, we have a variety of resources available to them. Training, we worked with JSI. I need to plug that. We worked with JSI to do the judges and attorneys orientation, and have kind of put that out there. So we have a bunch of new judges coming in this year. Yeah. And they're going to be able to access, fresh content around, what judges and attorneys need to know to be on a recovery court team.
Clearly, you and your association have done a lot, an exceptional amount for your members. Tell us what you think you might identify as one or several of the most significant accomplishments of the association, if you feel like you can narrow that.
Gosh. I do think that we have met and exceeded our original, first 2-3-year strategic plans. And this year actually is a new strategic plan, and I've been doing a lot of thinking about that and, talking to board members about, what is the next big thing, right? What is it that we want to look at for the future of TARCP? And, we don't have it nailed down yet, actually. Okay. So I'm not really sure. But I do know that the JSI collaboration was huge. That was the first thing we ever did, anything like that. I also think that, our conference has become, we're kind of a well-oiled machine at this point. And so we've got that down. The conference committee rolls into other committees, rolls into board participation, rolls into, relationships across the state. And there's a lot of value in all of that communication, networking, and relationship building with your peers across the state. You can't really put a tag on those kinds of things. And I know that we have done that for the field, allowed those or provided those opportunities for connection with their peers, not only at the conference, but in the other things that we do that bring them together. During the pandemic, we were having sort of coffee chats. The state had a regular Zoom meeting, but we also sort of had coffee chats where, we just, if you want to come and get on Zoom and, talk with your peers.
Reasonably well attended? How was the response?
10, 15 people, and they had good, they wanted to be there and they wanted to talk about something. So it worked, it worked for them at that time. We also we started a professional series, a self-care professional series during that time. And I get a lot of feedback about that. I don't write it, actually. Everybody gives me credit, but I have a social worker on who writes it, and she does a fabulous job. Our podcast, we do a podcast. So, I mean, there are all kinds of things that we could do. I almost feel like we need to kind of come back and, get back to some basics in a way, because we have been doing so many things. And I am proud of the work that we do. I really am.
With good reason.
Yeah, I think we have done a lot of great work for the field. And, what does that look like for the next 3 years,
Well, I was going to ask you what it looks like in the next 10 years, but obviously we're pleased to hear you speak positively of the collaboration with JSI, and perhaps that more of that might be in the future. Talk about challenges. What challenges have you and the association seen and faced?
Yeah, so, budgeting is always, from an association standpoint, funding, budgeting, how are you going to get paid to do the things that you do is always an issue. And, the state has been a great partner for us. So we have grants that we are either, we're administering or we're a pass-through for. And we have a great relationship with the state doing those kinds of things. Ultimately, what we would want is to always, be the administrator of or recipient of funds that are directly related to our mission. So anything technical assistance and training related. So those are the kinds of things I'm thinking of now for the field. Because the challenge has been finding sustainable funding that makes sense for our mission, right? We also spend a lot of time having conversations about, and I think about, I was listening to a session today on, the future treatment courts and the 7 calls to action. And they're all things that I think about when looking at training, technical assistance, when a person working in a recovery court in Tennessee calls me and wants to talk about these things, the racial disparities, using jail too much, the judge wanting to order treatment when that's a treatment professional's job, why aren't we taking people with violent crimes, all of these things that are, really the next phase for all of us, I think, are also challenges and opportunities in the state of Tennessee
It's really
for us to work on. The association, pardon me, Mac.
No, I spoke over you. Make sure you finish your thought.
I'm good.
Because, and the reason you touched on one of my questions in terms of now thinking about how Tennessee recovery courts can be improved. You mentioned that session where they raised the call to action. Did you just touch on some things that you believe are part of the way that Tennessee courts can be improved?
Yeah, to me, those are the things that if I were tweaking, we have a certification process. So the recovery courts all know what the best practice standards are because that's part of the certification process. And so really beginning to tweak, right? Also coverage. We are almost covering the state, but not fully covering the state in terms of access. So it is a mission of the state, and it is definitely a mission of ours to support the efforts to ensure that every eligible person in the state of Tennessee for a specialty court has access to a specialty court. When I think of 10 years, that's what I'm thinking, is that kind of access. But also, these other things that are on all of our minds, reducing jail, we're used to doing it. I worked in drug court, and so, the mentality of and the belief that that's valuable, how to move past that and into more therapeutic-oriented intervention, right? Racial disparities, violent crimes. Our state statute does not allow us at this point to take individuals that have violent crimes, but it is a conversation we have all the time. And there has been some reform work in our legislature around those issues, but violent crime hasn't really been addressed for us yet. And so, you think about the expansion of eligibility criteria and what allowing even, some variation of, what a violent crime, however you want to define that, whether that be a history or whether that be current charges. Individuals that have committed a violent crime in the state of Tennessee don't come to recovery court, but there's no reason really for them not to.
Any movement on the prosecutors in that area yet?
I mean, maybe. Maybe.
I get it. Well, we're winding down now, and I have to say, Marie Crosson, you are very humble. One of the things in the beginning I asked you to tell us about yourself, and one thing I happen to know that you left out. It is actually Dr. Marie Crosson, is it not?
It is.
So tell us, what was your dissertation in?
So I had the privilege of driving around the state of Tennessee talking to participants about their recovery court experience. And I specifically focused on looking at their relationship with the judge, interaction with the judge, their perceptions of the interaction that they had with the judge over the phases of their participation in the program, and how their perception might have changed as they were, further along in the process. And so that's what my dissertation was basically on, is what the relationship with the judge is like, and how meaningful, or what that means to the participants, and what that means to their success as well. Moving through the program, it was really a lot of fun. I enjoyed talking to them, as I always do. I like talking to the participants.
Okay, well, I just really wanted to make sure you got your due for that, for your title and the work that you put into it.
Thank you.
Is there anything I didn't ask you that you would like to talk about your association that you'd like to share?
I don't think so. We talked about a lot.
You did. You did. You covered quite a bit.
I always appreciate the way that you pose questions, Mac, too. You're a great interviewer.
Well, thank you. And I think with that, thank you for being here.
Thanks.